Good afternoon, everyone, dear chair, dear audience. My PhD topic is exploring HPV-associated diseases and their preventive measures. My name is Adél Mózes. I'm a second-year PhD student from the Department of Pediatric Dentistry and Orthodontics. My vision is to find the best options for HPV prevention and detection. And my mission is to decrease the prevalence of HPV-caused diseases. My two specific goals are to reveal the prevalence of risk of oral HPV infection in cervical HPV-positive women. And the second one is to analyze the concordance and risk factors between oral and genital HPV. So let's start with our first project, which is a systematic review and meta-analysis. HPV is the most common sexually transmitted pathogen of the 21st century, causing more than 5% of the cancers worldwide. Besides cervical cancer, HPV can also cause oropharyngeal, anal, vaginal, vulvar, and perineal cancer. And here I have to highlight the oropharyngeal one, the prevalence of which has quadrupled in the recent years. Therefore, our aim is to identify the association between cervical and oral HPV infection. Our first clinical question is, what is the prevalence of oral HPV infection in women with cervical HPV, using the COCOPO framework and hypothesizing that women with cervical HPV infection have a high prevalence of oral HPV. Our second question is, does cervical HPV infection increase the risk of oral HPV infection in women, using the PICO framework and hypothesizing that cervical HPV infection increases the risk of oral HPV in women? Here you can see our search key below, which we conducted in 3 separate databases, and the flowchart of selection. Finally, we ended up with 41 eligible full texts. Allow me to show our results. First, we measured the outcome in odds ratio with a 95% confidence interval. So here we investigated how many women had oral HPV in the cervical HPV positive versus the cervical HPV negative group. We included 34 cross-sectional studies with more than 5,000 patients. The heterogeneity was moderate, which can be explained by the different oral sampling methods and kits, the globally and individually different sexual habits, and the HPV negativity or positivity of the sexual partner. We got that the odds of having oral HPV in the cervical HPV positive group is 2.22 times higher compared to the cervical HPV negative group. This result is clinically and statistically significant. When we measured the outcome in proportion with a 95% confidence interval and creating groups for women with cervical HPV and without cervical HPV, we got that the prevalence of oral HPV in women without cervical HPV was 4%, versus the prevalence of oral HPV in women with cervical HPV was 13%. Here we included more than 2,000 and 4,000 patients with 34 and 41 cross-sectional studies. The heterogeneity here was high, which can be explained as I mentioned before. These results, I would say, also clinically significant because they say globally the oral HPV prevalence is between 5 and 10%, but we don't know it sure. When we created a subgroup for women with cervical HPV and with positive cytology, we even got a higher number for oral HPV, 17%. Among the strength of our work, we are presenting worldwide data, created subgroup analysis. HPV was confirmed by PCR test. We set a minimum genotype requirement, and we are presenting a large patient of cohort. Regarding the limitations, I have to highlight there is no standardized oral sampling method, and they use a little different test kits in the articles. We can conclude that women with cervical HPV have a 2.22 higher odds for oral HPV positivity, and 1 out of 8 women with cervical HPV has oral HPV positivity. For practice, we imply that oral HPV screening should be recommended for women with cervical HPV infection and with their partners. there is a need to raise awareness for oral HPV and its risk for cancer. HPV vaccination should be emphasized. For research, we imply that the effectiveness of oral HPV testing in the early diagnosis of oropharyngeal cancer should be investigated. I am happy to share with you that the Journal of Dental Research accepted our article, now we are waiting for the publication. Here you can see the preview. Sorry. And let's move on to our second project, which is analyzing the concordance and risk factors between oral and genital HPV within a single-centered cohort analysis. As we know, HPV infects the oral cavity and oropharynx through oral sex. And while there is cervical HPV screening and the number of cervical cancer is decreasing, until then there is no oral HPV screening, and the rate of HPV-positive oropharyngeal cancer is steadily increasing in the Western world. There are some well-known risk factors for oral HPV, such as oral sex, greater number of lifetime sexual partners, smoking, stress. Therefore, our aim is to identify the risk factors and the association between genital and oral HPV infection. Our first question, what is the concordance between oral and genital HPV in women and men? And we hypothesizing there is concordance between genital and oral HPV infection. The clinical implication would be to determine who should be screened for oropharyngeal cancer prevention. Second question is, how do lifestyle factors influence HPV positivity in women, using the PO framework and hypothesizing that some lifestyle factors are associated with HPV positivity. The clinical implication would be to identify who needs close follow-up and screening, also strategies for education and prevention. Here you can see your eligibility criteria. We are including immunocompetent adults. And right now we are at the data cleaning phase. We are cleaning almost 3,000 patients' data. We are cleaning the general medical history, lifestyle factors, comorbidities, and of course the HPV results. Regarding my additional activities, I'm also an orthodontic resident. I'm the member of the Semmelweis Doctoral Student Union and the National Association of Doctoral Students, and I won the Dental PhD Student of the Year 2024 award. Here you can see the summary for aims with the accepted and planned submission dates. And I would like to thank you for your attention with the words of Erasmus, prevention is better than cure. Thank you.
I have two questions. The first is what vaccines are available today? And the other question is, do they prevent the, in case of HPV positive oropharyngeal cancers?
Thank you for your question. In Hungary, at the moment there are two vaccines against HPV. One is the Semmelweis, which is a bivalent vaccine, and the Gardasil 9, which is a nonavalent vaccine. Gardasil 9, I would say, at the moment is the most effective vaccine because it can protect you against the two most common low-risk genotypes and the seven most dangerous high-risk HPV genotypes. Yes, and in 2020, the FDA approved the Gardasil 9 as a prevention of HPV-positive head and neck cancers, so it can protect you against.
Thank you.
I would like to know if the included articles reported if these women have received the vaccination before.
Thank you for your question. Yes, this is a very interesting question, and I got this question before. Some articles mentioned the vaccination status, but there were only just some. And here I have to highlight, if you are vaccinated, you also can get the HPV virus and carry for a little time, but it won't cause you cancer. So at that point, with my team, we agreed that we won't see the vaccination status of these patients.
How can we detect this oropharyngeal cancer? So what is the protocol to check them?
Thank you for your question. I would talk about that, the patients, how can detect first. So HPV-positive oropharyngeal cancer is a very small and I would say silent cancer. And mostly the first sign of this is a metastasized lymph node, which is a painless lump on their neck. So other symptoms, alarming symptoms, can be dysphagia, pain radiating to one ear, sore throat, soreness, but they are the general symptoms of the other head and neck cancers too, or they can be.
I would have jumped back to the vaccination. You mentioned that right now there are 2 available vaccines in Hungary. Any of those are mandatory to give to our child, or they are optional? This is the first question. And the second one, what is the year, so the years of age when it's recommended to get this vaccine?
Thank you for your question. It's not mandatory. In Hungary, there is a school vaccination program from 2014 where boys and kids can get the HPV vaccine on the 7th grade. And since then, there are more than 400,000 students have been vaccinated. So this is a very good program, but you can get the HPV vaccine at any age. You just have to visit your GP or gynecologist, or you can write a prescription for yourself and go to the pharmacy. And there is a 2 and a 3 dose regime.
And which one do they use for this vaccination right now?
They are using the Gardasil 9, as I know, which is the most effective right now. I think they started with Semmelweis, or there was a third vaccine, which called Silgard. It's no longer available. It contained 4. Yes.
Thanks.
Types.
Are the vaccines distributed for free here in Hungary?
They are free if you are vaccinated in the school program, but you have to buy if you are not in the school vaccination program.
Are these vaccines safe to use, or are there any adverse effects which can be there after vaccination, or can anyone get these when we are talking about the kids, or are there any risk groups who cannot get this?
Thank you for your question. As I know, they are one of the most safest vaccines, but of course first you have to consult with your GP or gynecologist. And if you are getting the vaccine after your sexual life started, I would recommend HPV screening before, because it's not a therapeutic vaccine, it's a preventive vaccine. So if you have already HPV, it won't cure that and can lead a false assumption that I'm safe.
Is there any reason to these vaccines be distributed for very low ages? I mean, adults don't receive them, so there is any reason for that?
It's recommended to get the vaccine before your sexual life is starting, so that's why the 7th grade.
A question on your view from all of your readings. Why is oral HPV increasing? I mean, I think, is it because that we can measure it better now and we're more aware? I can't, and I don't know the data, but have sexual practices really changed since when you think and you watch the movies of the 70s and what happened then? I mean, so that's one thing I'm thinking. Is it cigarette smoking's declined? I mean, I know it's still a problem, but I'm just interested from all of your reading if you think there are one or two variables that are key, or is it?
Thank you for your question. This is a very good one, and I think nobody really knows this one. We only can see tendencies. And yes, I would say that this is because of the sexual practices changed, but we don't know for sure, and we are living a more stressful life, they say, and yeah, it's hard.
I have a question. If you are looking into how many oral positive HPV patients we have who have cervical HPV positivity, that's good because we assume that these patients could have oral cancer, but do you have any epidemiological data in how many oral cancer patients have oral HPV positivity?
I don't know about these data, unfortunately. As I mentioned, they are doing the oral HPV testing, but it's not a standardized method. They are usually detecting oral HPV in 2 ways: the rinsing technique and when they are using a swab or brush. They are doing these 2 types of detection. They are publicating very good and high quality articles, but there's no standardized method for that.
But do they check oral cancer patients for this?
Excuse me?
Do they check oral cancer patients for
yes,
HPV?
In the oral cavity. So HPV causes cancer in the oropharynx region, not in the oral cavity. It's a little bit high.
I'm just wondering what is your opinion about that? Is it possible that within few years it will be a routine to check patients' oropharyngeal mucosa as similar to the women's cervical checks?
Thank you for your question. That would be one of my goals, but checking oropharynx region is very hard. Even doing oral testing from this region, it's very hard because it's hard to reach, and it's not as good as to the patient. But yes, my goal would be that professionals would work in an interdisciplinary way, so the gynecologist would send the patient to the otorhinolaryngologist or a dentist who has the knowledge for HPV and check these patients and they need to follow up, and also partner involvement is crucial because it's a sexually transmitted pathogen if there's partner.
In your results, I've noticed that you have quite a lot of articles.
Yes.
And quite high heterogeneity.
Yes.
And did you try to uncover the reason for this high heterogeneity? For example, if you go to the next slides, we can see that there are huge number of articles have a proportion of around, let's say, 5%. And in the bottom part, there are articles with 80–90% proportion. So yes. What did you try to find the reason why this high discrepancies there?
We tried this many times. The Crawford article had very high numbers, and the only reason is they were very high, but we couldn't exclude it because we checked the article and it was proper, so I couldn't say that, no, this is very high and I cannot include it. They use nested PCR technique, which is a more sensitive PCR technique, and also had a population with women with positive cytology. There were 1 or 2 sex worker population. And yes, on the bottom, they use the nested PCR technique, but not all of them, because if you say Tatar, it's in the middle. She also used nested PCR test, yet they didn't get those higher numbers. So yes, patient characteristic and oral sampling method, different sexual habits, HPV positivity or negativity of the sexual partner, stress, smoking, drinking.
So you cannot pinpoint anything, okay. And what about the study design? So were these like cross-sectional studies or
cross-sectional
case controls?
Studies, cross-sectional.
Only, okay, thank you.
Yes.